All right, folks, thanks for joining us today. We have a psychiatrist coming up who has joined us before our Midday Live, Dr. Ron Holt, connecting with us to talk about how, as kids look at this possibility of maybe spending another semester, possibly the whole year, we hope not, having to do distance learning, what kind of a toll does it take on them mentally, physiologically even, and just socially. Dr. Holt, how are you? Good to see you.
Hi, Kristen. It's an honor to be with you again. Thank you so much for having me.
Oh my goodness, it's been way too long. We've been trying to get you back on for what, 2 months now? So
yeah,
it's a good day.
it is a good day.
By the way, you're on Facebook Live right now with our viewers.
Awesome.
Hey, is there something you do every day at the start just to kind of reset and start the day right and put yourself in that good energy mode?
Well, what I do is I think things that I'm grateful for. Right. I'm grateful for my health. I'm grateful for the day. I'm grateful for housing. I just think things that I'm grateful for, and that kind of puts me in a good mood to get started. And then I do a little bit of light exercise before I shower, and that helps as well.
Did you say shower?
Yeah.
All right. Such a simple thing, right? But you're right. And I think routines also help too, right? Just like a nice routine.
There's no question. Even if you have nothing to look forward to that day, if you just get up and do your normal routine, exercise, shave, shower, it just kind of puts us back into kind of calms our brains and allows us to kind of mental health wise and refocus and be ready for the day.
All right. Hey, Facebook friends, if you have any mental health related questions for Dr. Holt, please go ahead and put them up on Facebook Live right now. I'll try to get some of them answered during the next 8 minutes, I think, that we have to talk. Let me check in with the producer. How many minutes do we have? 7 minutes? Okay. So post your questions now, folks, and we're coming back on air in 2 seconds. Welcome back. Mental health in this pandemic is a top priority, but how do you cope, especially as a college student or high school student? Joining me to talk more about this is San Francisco psychiatrist Dr. Ron Holt. Dr. Holt, most Bay Area schools, except for elementary schools that might apply for those waivers to open in person, will do distance learning to start. So kids, of course, did this in the spring, and some have gotten a glimpse into that experience on their mental health. What do you see there? What is so challenging for them during this time with regard to their mental health?
Well, that's a great question. And if you think about it, when we're normally in classroom, we have face-to-face physical interactions with others. We're able to see our teachers in person. For a lot of them too, they're able to get access to maybe some health care or some counseling through their school counselors. And also for some of them, especially if they're in college, they had access to food and shelter. And now all that's been kind of taken away because of this pandemic. And so when we're doing stuff remotely now, that's making things a lot harder for people. So when you take all the things that we just talked about and add that with isolation that we've done for several months, that definitely puts kids and students at higher risk for mental health issues, including depression and anxiety.
All right, so given that you think anxiety, depression might be more possible or likely, what can students do to fight that? And then, tell us about that. And then I also want to go into what parents can do to support them.
That's a great question. Okay. And so here's my thought is that for a lot of us, if we're feeling stressed right now, is just reaching out to others. And that could be your best friends, or it could be people in your classroom outside of Zoom, and either doing a phone call with them or just chatting or doing texting with them. So something to kind of make a person realize that they're not alone, because there's always safety in numbers. So I think reaching out would be helpful. I think also just doing some deep breathing too. Like when we're feeling really stressed, we kind of have our amygdala part of our brain, that's our fear center, that really kind of gets worked up. And so sometimes just doing some deep breathing, closing our eyes and doing some deep breathing allows us to come back to the prefrontal cortex and allows us to think through things more clearly as well. Also, I think is also very important is practice journaling. I mean, a lot of times now we have a lot of negative thinking. And so if we're able to take those negative thoughts and write them down, that kind of gives our brain permission to let them go and put them away. And then that allows us the opportunity to have more positive thinking coming in as well. And one of my favorites too is also reframing our thoughts. it's so easy for us to say, oh my gosh, I can't go to school. I'm stuck here. I'm on Zoom. I can't really do the things that I want to do. And we have to reframe that. And we have to tell ourselves, I feel grateful that I'm able to stay at home, because then that means that it keeps me safe and it keeps my family safe from getting COVID. And so it all depends on the way that we structure our feelings. And so if we take away our negative feelings and reframe them in more positive thinking, then it makes us feel better about what our current circumstances are.
Talking to your kids is very challenging, especially if they're really young. Our viewer Marie has a question about how do you explain to kids why they can't hug or meet up with their friends right now in a caring way that they can understand?
Yeah, and that's a great question. And, I think what I would do is just say, I know, Johnny, this is a really hard time for you right now. We have this pandemic going on. The last time we had something like this was over 100 years ago. That was a long time ago. But that means that we're not able to be physically with our friends and family right now because we don't want to get this illness. And so I think if we just explain to them that this is a temporary thing, but it's going to keep us safe, and that eventually we will be able to connect again, I think that's going to allow them permission to understand that and realize that this is not a long-term thing. It's just temporary. And by them following through and not hugging others, that it keeps them safe, but it also keeps mom and dad safe as well.
Okay. Other than just asking your kids straight up, like, hey, are you depressed? Are you okay?
Yeah.
What are some other ways we can kind of dig into that and recognize some signs?
That's a great question. So here's the thing for depression. If you notice like 5 or more of the following symptoms for more than a 2-week period, then it's probably time to reach out to your kid and say, hey, I'm noticing some of these things in you. What do you think? And so things such as sleep, like changes, either sleeping too much or not sleeping enough, interest level being different or off, having issues with feeling guilt, maybe energy level being low, problems with concentration and memory, maybe changes in appetite, such as eating too much or not eating enough, and also some passive thoughts of maybe being better off not alive. And if you start to notice some of these symptoms in your student, or your kid, it's totally okay to say, Johnny, it seems like there's some changes in your behavior that I didn't really notice before. I'm kind of checking in with you and wanted to see whether you feel that this is true or not. And, they may say, well, gosh, I never thought about that, mom or dad, but I guess that's true. And then it's okay to say to them that, it's okay to not be okay, but, it's not okay to not seek treatment. And so if you want, I'll be happy to connect you with the school counselor or your primary care provider to see what kind of resources are available to help you get through this, because we are in this together.
All right. Well, as a parent, sometimes I wonder if I see something that I think my kid should do that would help him or her, should I just only suggest it, or should I force the issue, right? Like, how much do you push? Like, let's say I really think going for a run daily will help my son, but how far do you go, and how do you juggle that?
Well, that's a great question. And the thing is that, as you know, as a parent, that if you force your kid to do something, they're not going to do it. So you've almost got to make them think that it's somehow their idea.
Yeah, how do we do
maybe
that?
just come and yeah. So for instance, like you can just say, I was just at work today and I was talking to some of my class or some of my colleagues, and they were saying that their kids are going out, and maybe you might be able to say to them, it's like, I heard that some of my colleagues' kids are like going out for walks or safely, and are feeling better about that. I'm wondering what your thoughts are about that. I mean, just kind of put it out as like, this is what I've heard. I'm wondering what you think. Because then if they want to incorporate that into their lifestyle, they'll do it. And they may not do it in the moment. They may think about what you said because you're mom and they don't want you to think that you're right.
Right.
But later on, right? But later on, like a couple days later, they might come back and say, I'm actually thinking about going for walks. It's like, oh, that's great. And so I think just planting the thoughts in their minds, right, helps a lot. And it doesn't have to be this whole barrage of lists of things all at one time, but just like on occasion each day, just like, I understand that also people that go out for runs, it seems to help them. I saw that in a news article. That sounds interesting, doesn't it? And so if you just kind of plant it in their mind for them to kind of think about, and they may not respond in the moment, but when they're ready, they will.
All right. Plant the seed, but don't force it, because I guess they need to feel like they have some control over their lives right now, especially now, right?
That's right. That's
All right.
right. That's right.
Dr.
Yeah.
Ron Holt, thank you so very much. Some great information and ideas, and I hope that will help a lot of our viewers out there watching. Take good care.
Okay. Thank
See you
you
again
so much.
soon.